Could you tell us about the psychiatric consultation for the medically complex program, or PCMPC, that you direct? Why was it set up and how it provides rehabilitation for those suffering from long COVID?
Yeah, so many psychiatrists like myself often work in hospital-based settings. We tend to work on medical floors, and we work with all sorts of patients that have really, again, this complex intersection. So maybe they just got a transplant or need a transplant, or maybe they have a neurological disease that causes psychiatric symptoms, or maybe they experience things like steroid-induced psychosis, whatever it may be. And we have lots of specialists that see them on the inpatient side. And then when they get discharged back out to the community, there isn't as many places that feel comfortable managing those kind of diseases. So that's where the kind of impetus for this clinic came from. It was made by a predecessor before me and really focused on helping these patients transition out of the hospital. And then when I joined faculty back in 2018, I kind of got to take over that clinic and worked on sort of expanding it to take referrals from many specialists within our hospital system and many patients from the community. And so that's how we ended up treating like transplant patients, neurological patients, and all of that.
So how do you provide rehabilitation for long COVID survivors?
I got approached shortly before the pandemic by a pulmonologist who already had interest in my clinic because she was getting ready to work with post ICU patients. And there's a lot of neuropsychiatric symptoms that come from that. So we'd already been in discussion. And then the pandemic hit, and she was pivoting her clinic because she started to realize there was going to be a lot of patients who needed kind of higher levels of pulmonology and critical care kind of things in outside of the hospital. And so she kind of asked if I would do that with her, and we started to share patients and just try to learn together to figure out how to support folks going through this. And so my clinic really focuses on the mental health component. So that's like diagnostic evaluation, treating neuropsychiatric symptoms through medications or psychotherapy, and kind of helping arrange referrals sometimes to other specialists as well. And so that can be referrals to sleep medicine, cardiology, or speech therapists to help with cognitive rehabilitation.
Yeah, you kind of forget as a physician that a huge range of diseases when you're hospitalized can affect your mental health, whether directly or indirectly, whether it's through the trauma of going through the disease or whether having the disease affects how your brain functions and therefore leads you to develop psychiatric illness. I'm amazed that we don't have those types of clinics everywhere.